For millions of people living with chronic low back pain, real relief can feel rare and often fleeting. But a new treatment called ReActiv8 is changing the game. Joining us with more is Dr. Martin Burke, Division Chief of Pain Management at MUSC. Dr. Burke, thank you for joining us today. What is ReActiv8?
Thank you for having me. So ReActiv8 is a new treatment that exists for patients that have chronic low back pain related to a specific muscle dysfunction in the low back.
Okay.
And so for these patients, they've suffered low back pain for many years and tried many other treatments that have not alleviated their symptoms. And this provides a new option for some of these patients.
Why is lower back pain so difficult to treat, or it has been in the past?
That's a great question, and it still is. And one of the reasons is that there's so many different things that can cause low back pain in our patient population, whether that's a disc issue, post-surgical, a joint issue, and so sometimes it can be difficult to really identify a specific cause in a specific patient.
So ReActiv8 is an implant. So how does it work to provide the patient relief?
So it's an implant that's implanted in a 45-minute outpatient procedure. So what it does is it targets the nerves that allow muscles in the low back to contract. And so for these patients that have multifidus dysfunction, which is the muscle in the low back that we target for the ReActiv8 procedure, we have evidence on MRI and on physical exam that this muscle is dysfunctional. So the implant targets these nerves. And two weeks after the implant is put in, the patients can activate this device and it causes these muscles to contract 30 minutes in the morning, 30 minutes at night, and over several months it regenerates that muscle's function.
And can they do those from home, those 30-minute sessions?
Absolutely. And many patients do that before they go to work in the morning or right before they go to bed.
Okay. And who is the ideal candidate for ReActiv8?
Great question. So the ideal candidate is somebody who has chronic low back pain. Multifidus dysfunction is evidenced by physical exam findings that we can do in clinic, or we can see this muscle atrophy on MRI, and by their history. So these are patients that have low back pain that gets worse with small activities such as brushing their teeth, doing dishes, small movements, because this multifidus muscle stabilizes each segment of the lower lumbar spine. And in these patients, that multifidus muscle doesn't function appropriately, so when they move, their lumbar spine gets overloaded and causes pain.
And you mentioned earlier that 2 weeks after the initial procedure is when they can start doing the 2 30-minute sessions a day. So what is the recovery time?
The recovery time is pretty short. And so it's a small surgical procedure, so patients have about a 1-inch incision in the middle of their low back and about a 2-inch incision in flank or love handle. And the first 2 or 3 days are the worst, as just recovering from any surgical procedure is, but really after that period of time it's just soreness. And then at 2 weeks out from their implant, they start using the device.
When do patients typically start to feel relief?
Great question. So because this is a muscular issue, it takes time for these muscles that have been atrophied for so many years to start gaining function. Most patients notice functional improvement in about 3 months, and some patients get pain relief for that period of time too, but oftentimes it's 6 months before patients start to see significant pain improvement.
Is this implant something that needs to be replaced every so often, or what does it look like for a lifespan of a patient who gets this implant put in? Is it something that you have to keep up with or get changed out? What does that look like?
Absolutely. So for most patients, this battery life lasts greater than 10 years. And so for many of these patients, it's really not an issue that, getting a battery changed. The battery replacement procedure is another quick 30-minute surgical procedure to replace the battery for patients who need it.
And this is fairly new, but there are some results. So what is the research saying about the long-term effects of ReActiv8?
That's the best part, is that the research has shown, it's a study by the ReActiv8 company called their B trial. Going out 5 years, they've shown that close to 80% of patients have at least 50% of their pain improved at 5 years out.
Wow.
And about 70% of patients who were on opioids before they had this implanted had either reduced or eliminated entirely their opioid use.
So this is groundbreaking.
Absolutely.
What does this say about the future of treatment for chronic pain? Do you think that we're going to be seeing more things like ReActiv8, these implants? I mean, the proof is in the pudding, right? It's working, but what does that say to you about the future of chronic pain treatment?
My hope is that we can start to really engineer treatments that are designed to restore function and not just have palliative treatments, because we have lots of treatments like spinal cord stimulation that block pain signals and are palliative, but this is the only one we have in our field that is restorative and really works to regain muscle function.
So if someone thinks that they would be a good candidate, where should they go?
MUSChealth.org, looking at the pain management website, and through that website they can schedule an appointment with us.
Wonderful. Dr. Burke, thank you so much for being here and talking about this very exciting thing.
Thanks for having me.
We're back in 2 minutes.